Breastfeeding. Breastfeeding is a natural and beautiful way to nourish your baby and build a strong bond. This guide will walk you through the benefits of breastfeeding, how to get started, and helpful tips for success. Breastfeeding is the normal way of providing young infants with the nutrients they need for healthy growth and development. Exclusive breastfeeding is recommended for the first 6 months of life. The WHO defines exclusive breastfeeding as feeding the baby only breast milk during this period, with continued breastfeeding alongside appropriate complementary foods up to 2 years of age or beyond. Advantages of breastfeeding. To the baby, breast milk contains natural protective ingredients that are not found in breast milk substitutes formula, which help protect the baby from illnesses. Breast milk is easily digested and reduces the baby's risk of diarrhea and constipation. Breastfeeding lowers the baby's risk of developing allergies, asthma, diabetes, and certain cancers. It supports brain development in babies. Breastfeeding continues to protect the baby from infections even after weaning. For the mother, breastfeeding helps mothers heal after delivery by reducing bleeding and shrinking the uterus involution. It burns about 600 calories a day, aiding in returning to pre-pregnancy weight. Breastfeeding saves money on formula and medical bills. The hormone released during breastfeeding strengthens the bond between mother and baby, promoting relaxation and calmness. It lowers the mother's risk of breast and ovarian cancer, diabetes, and cardiovascular diseases. For everyone, breastfeeding mothers miss fewer work days because their infants are healthier. Breastfed babies tend to have lower medical costs. Breast milk is natural, requires no preparation, and is always at the right temperature. Breastfeeding calms babies or toddlers, making nap time and bedtime easier. Colostrum, the first milk colostrum production. By the 4th month of pregnancy, the breast starts producing colostrum, the first milk, which is essential for newborns. Colostrum may be yellow or clear. Colostrum benefits. Colostrum boosts the baby's immune system, is easy to digest, and provides all the nutrients needed per feed. Newborn stomach. At birth, a newborn's stomach is small and can hold about 1 teaspoon of colostrum per feed. As the baby feeds, the stomach and appetite grow. Colostrum is essential. Colostrum is the only nourishment babies need in the first few days after birth. Early feeding. The baby should be fed within 1 hour of delivery, even after a cesarean section. Some babies may be sleepy in the first few days and need extra time to practice breastfeeding, making it harder to collect. Hand expression of colostrum. Hand expression is better than pumping for colostrum because colostrum can stick to pump parts, making it harder to collect. Simple method. 1. Wash your hands. 2. Use a clean container with a wide opening or a spoon to collect colostrum. 3. Position your fingers and thumb about 1 to 2 inches away from the nipple. Press your fingers toward your ribs. Squeeze gently and catch the milk in the container. Relax your hand and repeat the process. 4. Be patient. It may take a few minutes before colostrum appears. Breastfeeding positions. Laid back hold. Lay back with pillows for support. Place your baby face down between your breasts. Adjust to what feels natural. Cover your baby with a blanket if needed. Cross-Cradle hold. Use a pillow on your lap to bring the baby to breast level. Align the baby's tummy with yours, with the nose opposite the nipple. Support the baby's head with your hand. Lift your breast to guide the nipple to the baby's mouth. Clutch, football hold. Place a pillow at your side. Position the baby under your arm with legs extending behind you. Support the baby's head and neck. Side lying hold. Lie on your side with your baby facing your nipple. Support your baby with a pillow or blanket. How do I attach my baby to my breast? 1. Hold your baby so that their nose is in line with your nipple. Touch your baby's nose and upper lip with nipple. 2. Wait until their mouth opens very wide. 3. Quickly bring the baby onto your nipple and breast so that their chin touches your breast first and they get a large mouthful of nipple and breast. 4. If you feel painful tugging or pinching, slide your finger into the corner of his mouth to break the suction and try again. It may take a few tries to get a good, comfortable latch. Tips for getting a good start in breastfeeding. Breastfeed within the first hour after birth. Feed only breast milk to the baby. Hold the baby skin to skin as much as possible. Do not give pacifier to baby. Feed on demand as baby cries. How often should you feed your baby? Look out for signs of hunger, which includes 1. Whimpering or lip smacking. 2. Making sucking motions. 3. Waking and looking alert. 4. Pulling up arms or legs towards middle. 5. Moving hands or fists to mouth. How do you tell if baby is full? Baby lets go of your breast and nipple. Falls asleep and stops sucking. Relaxes hands and body. Breast care tips. Practice good hygiene. Wash hands before touching breasts. Keep the breast and nipple clean by washing them each day in warm water when having a bath. Wear a supportive, well-fitting bra. Ensure the baby is latching correctly and feed every 2 to 3 hours. Change breast pads as needed. Common breastfeeding issues and solutions. Cracked or sore nipples. Pain and discomfort during or after breastfeeding. Solution: check baby's latch and adjust as needed. Use nipple creams or lanolin to soothe and heal the skin. Air dry nipples after feeding and avoid harsh soaps. Or flat nipples. Nipples that are flat or turned inward can make latching difficult for the baby. Solution: use nipple shields to help draw the nipple out for easier latching. Stimulate the nipple manually or with a breast pump before feeding. Roll or massage the nipple to make it more erect. Consult a lactation specialist for personalized techniques and support. Engorgement. Breasts become overly full, hard, and painful. Solution: nurse or pump frequently to relieve fullness. Apply warm compresses before feeding and cold compresses afterward. Gently massage breasts to ease milk flow. Low milk supply, insufficient milk production to meet the baby's needs. Solution: increase breastfeeding frequency to stimulate production. Stay hydrated and eat a balanced diet with lactogenic foods, e.g. oats, fenugreek. Consider power pumping, short, frequent pumping sessions to boost supply. Blocked milk ducts, a small lump or soreness in the breast due to milk buildup. Solution: breastfeed or pump more often to clear the blockage. Massage the area gently toward the nipple during feeding. Apply warm compresses to encourage milk flow. Try switching cleared feed, baby falling asleep during feeding. Baby doesn't feed long enough to get sufficient milk. Solution: gently tickle baby's feet or stroke their cheek to keep them awake. Try switching breasts mid-feed to re-engage their interest. Overactive letdown. Milk flows too quickly, causing baby to choke or struggle. Solution: nurse in a laid-back or reclined position to slow milk flow. Express some milk before feeding to reduce initial pressure. Burp baby often to release trapped air. Mastitis. Breast infection characterized by redness, pain, and flu-like symptoms. Solution: continue breastfeeding or pumping to empty the affected breast. Rest, stay hydrated, and use warm compresses. Seek medical attention for antibiotics if symptoms persist. Thank you for your attention. We hope this guide has been insightful. Feel free to ask questions or reach out for further support. Wishing you the best on your breastfeeding journey.